Here we go, Treadwell DPT back again with another anatomy breakdown, muscle by muscle. Rounding out that posterior thigh, we've covered biceps femoris, we've covered semimembranosus. Now for that third muscle of the hamstring group. Thick and flat at the same time, we're talking about the semimembranosus. Another big player in hip extension, knee flexion, posterior chain stability, crucial not just for sprinting and cutting, but also for everyday posterior support. Let's break it down. We'll hit origin, insertion, function, innervation, and we'll wrap it up with a few clinical tidbits. Our semimembranosus sits in that posteromedial thigh. Originates on that ischial tuberosity of the pelvis, that same sit bone that the other two hamstring muscles attached to. But it's interesting, the muscle sits medial to the biceps femoris and deep semimembranosus, but it originates slightly superiorly and laterally to those other two hammies. From there, it runs down and slightly inward before it then inserts onto the posterior part of the medial condyle of the tibia. Much flatter in shape and broader than semimembranosus. Its large, flat tendon also expands out to insert into the medial meniscus, as well as some of the surrounding ligaments and fascia in that posterior knee, or popliteal area. So all it gives is a stabilizing influence at the back of the knee joint capsule. Both the inserting tendon and the originating tendon are broad and flat, but that originating tendon becomes especially thin and even membranous at points, which explains the name. This unique and complex structure is one of the reasons it's such an important stabilizer in that posteromedial knee. But in the simplest terms, the semimembranosus originates on the ischial tuberosity, slightly superior and lateral to the origin of the other two hammies, and it'll insert onto the posterior surface of the medial tibial condyle. So keep that in mind. Very, very typical basic hamstring action here as well. As the semimembranosus crosses both the hip and knee joints posteriorly, performs hip extension and knee flexion. It also contributes to medial rotation of the tibia at the knee when the knee is flexed, and it may assist with medial rotation of the hip as well. It's important for deceleration, slowing down that forward motion during running and sprinting, an important control for that swing phase of gait. It's also an unsung hero in activities that require powerful hip extension with knee flexion control. So think pulling in the gym, bounding drills, or even getting out of a deep chair or squat. Main idea, hip extension and knee flexion. Another nice, easy innervation as well. We mentioned that the overall idea when it comes to the hamstrings is that all of our hamstring muscles are at least partially innervated by that tibial nerve. Semimembranosus is no exception, purely innervated by that tibial nerve, roots L5, S1, and S2. So just to reiterate, semimembranosus is solely innervated by the tibial nerve, L5, S1, S2, branching off of that big, huge sciatic nerve. So again, nice and easy. If we're talking hamstrings, you can safely assume tibial nerve innervation, as well as knee flexion and hip extension. We've already alluded to it, but the major insight to highlight here is that the semimembranosus is extremely important to the stability in that posteromedial knee. It doesn't just insert into the tibia and blend into the posterior knee capsule. It has a direct attachment to that medial portion of the meniscotibial ligament, which connects the medial meniscus to the tibia. So that means tension in the semimembranosus can influence meniscal position and joint stability. For those unfamiliar, the meniscus is a wedge of cartilaginous tissue in that knee joint that serves as sort of a shock absorber. The medial meniscus specifically plays more of a stabilizing role, being slightly restrictive to tibial femoral movement on that medial side of the knee joint. So having that meniscus present reduces friction and wear across the knee joint. Removal of the meniscus leads to increased contact stress, as well as wear and deformation, and then of course, as a result, pain and knee symptoms. Around 40 to 60% of the load on an extended knee joint is transmitted to the meniscus, but during knee flexion, the load distribution can increase up to 90%. Modern anatomical studies confirm that we've got multiple tendinous divisions of the semimembranosus distally that'll insert into and around the posterior capsule and medial meniscus, introducing traction forces that can directly or indirectly pull on both the meniscus and the joint capsule. Recent ultrasound studies have shown that during tibial rotation, the medial meniscus, joint capsule, and semimembranosus move together in a coordinated fashion. This is potential evidence that semimembranosus action may be transmitted via that posterior capsule to dynamically influence meniscal positioning. So all of these little interactions suggest that semimembranosus isn't just another hamstring muscle. It's not solely capable of moving the leg. It's not solely capable of moving the knee or extending the hip. It's got a ton of smaller functions that we don't really consider. It is actively involved in posteromedial knee control, meniscal stability, and load transmission in that posterior compartment. In practice, that makes having a strong, healthy semimembranosus an important component of knee health. Whether you're returning to sport or simply trying to stay on the field, you definitely want to make sure you're not neglecting those hamstrings while you're hitting the gym. Very, very important that you're not skipping leg day. But hey, there you have it, the semimembranosus, the broad, deep stabilizer of the medial hamstring. The anomaly, flat and thick. Definitely want to use a little bit of nuance when you're talking about it. Different areas look different, right? Big in hip extension, big in knee flexion, big for posterior knee stability and control. Definitely a nice, important muscle that plays this role. Understanding the unique anatomy of semimembranosus can definitely give you an edge in both rehab and performance. So you definitely don't want to forget this bad boy. Hey, there's another one. Much, much more in store, even more to come. Stay tuned, stay locked. It's Treadwell DPT. I'll catch you next time.